So welcome to another episode of the Rogue Dermatologist podcast. And today I have a very special treat for you, Mr. Dean Clancy of the Americans for Prosperity. And we are here to discuss Obamacare, or the Affordable Care Act. And Mr. Clancy, it's great to see you. And thank you so much for being on the podcast.
Oh, it's my pleasure.
So what is the Affordable Care Act in a nutshell, and how did it come into this world?
The Affordable Care Act, Obamacare, is a massive federal law that has far-reaching implications for American health care. It's 14 years old now. It really took effect 10 years ago. We've got plenty of data now, and we know that it's had very deleterious effects on American health care. Some things about it people would celebrate, but I'm not one of those, generally speaking. I'm a health policy wonk, and I try to look at these things objectively. And Obamacare has been a bit of a disaster. You asked how it got started. It you can go all the way back to the early 90s with the Clinton Health Security Act. President Bill Clinton and his wife, Hillary Clinton, came up with a plan to reform American health care. It was very controversial. And it was defeated in 1994 because Democrats, the president's party, were divided over it. Republicans were solidly opposed to it. But between 1994 and 2008, when Barack Obama was elected president, Republicans really didn't do much to try to reform health care. They had opposed the Clinton plan, but they didn't really come up with a good idea of their own. And so many of us thought that Hillary Care, as we called it, will probably make a comeback. And sure enough, it did in 2009. And by 2010, it had become the law of the land. It was passed on a partisan basis. Only Democrats supported it, and all Republicans opposed it. It's unfortunate. It's the first major health law that wasn't bipartisan, and it has continued to be controversial ever since.
So let's actually go back a little bit in time and look at the issues or the problems that Hillary Care and Obamacare later on were aiming to fix. What were they trying to reform there?
Well, a couple of things. One, of course, was the goal of making sure everybody in America has health insurance. We have traditionally in this country had a fairly large percentage of Americans who have no health insurance. They're uninsured. That's not the same as not getting health care. It just means they don't do it through insurance. Back in the 90s, it was about 15% of Americans were uninsured. Today, since Obamacare's enactment, it's down to about 8%. We can go into the nuances of that. That was the first thing. The second thing was the cost of health care. It has been rising continuously and usually faster than general inflation for decades, really going back to the 1950s. And certainly since the 1970s. And so every politician who comes along wanting to reform healthcare almost always starts with saying, I'm going to make it more affordable. And that's the thing that Americans care about most. At Americans for Prosperity, we do a lot of polling, focus groups. We talk to people on their front doors. And they always list the cost of healthcare very high up there with jobs, inflation, immigration, and other issues that are top of mind for them. So those are the two reasons why those big laws that we're talking about here, those bills, were proposed: uninsured and high costs.
So they wanted to basically certify more people under the umbrella of insurance, whatever that means, right. And we'll break it down later on. And they wanted to make it more affordable. Now, to me, I'm listening to you, and getting the government to make anything more affordable sounds like a recipe for disaster. So how are they going to make it more affordable exactly?
Well, if you want anything to be more affordable, you have to let market forces work. Let buyers and sellers come together in a free market, and you get what economists call a market clearing price. It's the price that the buyer's willing to pay and the seller's willing to accept. And we know it works because it works in virtually every part of our economy. You look at computers and televisions, consumer electronics, and many other things, their prices fall over time and the quality goes up. And then you look at other things like healthcare, education, housing. Those are areas with heavy government involvement, and their history is very different. Costs tend to rise, and quality tends to be mediocre or falling, or not rising as fast as it might otherwise do. And it's because government rules, mandates, and distortionary subsidies prevent buyers and sellers from getting together in a marketplace. So American healthcare is really expensive because of many government policies that have been layered on top of each other over the decades, all of which have tried to make it more affordable, but they never did it by removing the past mistakes, clearing barriers between buyers and sellers, patients and doctors and hospitals and so on. They've done it by mandates, price controls, basically constantly making it more complicated and less like a free market.
It sounds exactly like you were saying. So instead of actually removing themselves from the process further, which would have been the right approach, allowing people to determine what the right value and the price paid, the price points for any services provided under so-called healthcare medicine, they actually inserted more mandates, more regulations, and more impositions to make healthcare more affordable. Now, what was the debate like at the time between Republicans and Democrats? Were there any of these concerns? I imagine the concerns were aired and addressed in some form of rebuttal. What was the rebuttal?
Well, back in the 20th century, the debates were more about getting people covered through national health insurance or single payer than they were about costs. Costs really took off as an issue in the 1980s. That's when people really became concerned about it as the number one issue. And Democrats, going back to the progressive era, had wanted national health insurance. Just get rid of the private health insurance companies, just have the government pay for health care, be the insurance company for the entire population. And they made steps towards it, like Medicare in the 1960s and Medicaid and the HMO Act of 1973, and then expanding on those programs with the goal to eventually have a government takeover. Along the way, Republicans generally either stood firmly against it, saying this is socialized medicine, it's the wrong way to go, or they cooperated. Medicare and Medicaid had passed with bipartisan majorities in 1965, although it was mostly Democrats, but it was bipartisan. The programs were popular. They caused a surge in medical inflation right off the bat, but basically, Republicans didn't find their free market voice until the 1990s and the Hillary Clinton plan. And then they began saying, you know what, we need to go down a different path. And they realized that probably the most important thing fueling medical inflation is the United States tax code, because employer-provided health benefits, the insurance you get at the workplace, is not taxed as income. It is income, it's compensation. It would ordinarily be taxed under an income tax, but it's exempted. That was another one of the things that was done along the way to try to promote more people having health insurance. Well, it fueled inflation because when people are over-relying on insurance, and that's what that tax break does, it causes them to want to consume more of insurance versus other things. Basically, they lose touch with the price of care, and pretty soon they're only thinking about, well, how can I get more free stuff? And by the way, we're all victims of this. I have employer-provided health insurance too, and I'm sure I overconsume because that's my economic incentive. But we've gotten to a point now where 90% of American healthcare is paid for through insurance, through third parties, including government programs, and only 10% of healthcare is paid for out of pocket directly by the patient. We've lost touch with the price of healthcare. We don't even ask the price. We're afraid to ask the price. And frankly, the doctor usually doesn't know the price either because it's an insurance company that's setting the price, effectively speaking. So where were the conservatives and the Republicans all along on this? By the 90s, they had realized we need to fix that problem in the tax code. We need to stop layering on new government programs and mandates. We need to empower consumers. That's where they came up with an idea called health savings accounts, which would basically give that same tax break that employers get to individuals. And so you would have tax-free money in your savings account that you could use for medical expenses. That would level the playing field a little bit and reduce that inflationary effect. When you're spending your own money, you're more careful with it than when you're spending somebody else's money. So by the time of Obamacare, Republicans and conservatives had become very firmly committed to ideas like health savings accounts. They said that if you do Obamacare, if you enact this thing, prices are going to go up, and we're going to have more government control, and it's not going to be the end of the story. It's probably going to fail, and you're going to blame the free market, and then you're going to demand another expansion of government. And 10 years in with Obamacare, I would say those predictions are coming true.
It's very much in line with that. And what's really amazing is that not only did it make healthcare more choppy, and the value of healthcare is not apparent to either side of the equation, the physicians and the patients. It's certainly more expensive. And that the Affordable Care Act, if I'm not mistaken, actually led to job loss in the private sector. Is that correct? And if so, how did it do that?
Well, Obamacare includes what's called an employer mandate. It, for the first time, said employers, you must offer affordable health insurance coverage to your workers. They made an exception for small businesses under 50 employees. But all other businesses have to offer benefits. It used to be optional for businesses. They'll be fined if they don't do it.
Right.
And what is the definition of offering it coverage? Well, first of all, you have to offer it to your full-time employees, and they define full-time as 30 hours a week. So that's caused a bunch of employers to restructure their workforce. So they have more part-time employees, fewer full-time employees by that definition. So then they can get under that 50 employee cap, and then they don't have to provide the health benefits, or they don't get fined for not providing generous enough benefits. And that's probably the main thing that has distorted the economy. Also, the growth of government programs like Obamacare and Medicaid, the program for low-income Americans, which was greatly expanded as part of the Affordable Care Act, they displace private coverage. They give employers an incentive to basically try to stop offering coverage and put their employees on the government program. It's easier for the employer to do it if they can get away with it without having to pay those fines. And many of them do find a way to do it. So in general, the employer mandate, plus all of the problems of Obamacare that have simply driven up the price of health insurance and health care generally, have created a drag on our economy. It certainly has destroyed jobs. Can I quantify how many? No, but it's a lot.
And also, as I understand it, I've watched an episode of Dave Ramsey's where he was ranting about the Affordable Care Act shortly after it was implemented. And he said, I'm not able to hire the people I wanted to hire because I have to spend all this money on health benefits.
Right.
And I don't have the money to hire the amount of people that I was planning on hiring. It basically is eating into my budget.
Right. And it's really hurting employers, especially small employers, people with, 50 and under employees. They're just trying to make widgets. They're just trying to sell a service. And the cost of healthcare is breaking them. And really nothing that's been done over the years to give them relief has worked. And so, my test for when we're going to get a complete government takeover of healthcare is when the employers, the employment community says, we're done. Give us government. We're tired of trying to offer health benefits at these prices. We can't do it anymore. That'll be the tipping point. Hopefully we never get there, but I'm worried that we might.
Yeah, and that is I'm deeply concerned about that as well. You and I spoke about that before. And what is really concerning is once you actually squeeze out all the so-called private insurers and smaller sized businesses out of that market, you are left with a government monopoly, and you're left with a one single payer system, which could spell a whole lot of trouble beyond just the costs, which are going to be naturally increased and inflated. There's other issues here as well. Wouldn't you agree?
Absolutely. Monopolies always deliver, subpar benefits at exorbitant prices. That they're monopolies. They can get away with it. They have no incentive to do otherwise. And government is a monopoly. And if we go to a single payer healthcare system, as many countries have in some form, we're going to get the same negative results that you see in those countries. People standing in line for care, having to wait weeks to get an appointment with a specialist, not having enough equipment or up-to-date equipment to take care of them. People complain that the American healthcare system is overpriced. It's too expensive. We do, I think, spend too much. But guess what? We have the best equipment. We generate more new drugs and cures, and we still have a little bit of a free market left, and that is keeping the system afloat. If we go to a complete single payer system, it'll be like what's in Canada. Now, in Canada, the people will all say to you, national health insurance is very important. We support that. But then they do a poll recently, and they ask Canadians, would you be willing to travel to the United States to get care that's supposedly free here in our country, Canada? And something like 70% of people said, yeah, I would. And the health minister basically chewed them out publicly. It was unpatriotic to criticize the national health program. But the fact is, monopolies don't work, and we don't need them. The free market with, government safety, guardrails, reasonable regulation, the free market can deliver the best quality healthcare at the best price, and it's the only way to do that.
Absolutely. And what's really egregious about, I think, the Affordable Care Act, that's the one thing that really stands out to me in retrospect, is that they turned insurance companies into something that is more of a middleman that's swimming or skimming up the top from both the physician and the patient to deliver zero value, just come in between those two and just siphon the value out of the interaction. And I'm talking specifically the cancellation or the revocation of the exclusionary criteria that insurance companies are by design meant to implement, so they can screen out clients or customers that are actually economically viable for the company to continue and sustain itself as a business. And that was completely eliminated, as I understand it, under Obamacare. Is that correct?
Essentially so. You're correct. The insurance is based on risk. It's just a mechanism for people to transfer risk off of themselves onto a large group of people who also want to share risk at a price everyone can afford, optional, voluntary. It benefits everybody. The world is better for insurance, but it has to be priced according to risk. In healthcare, risk, of course, means your medical condition. And before Obamacare, it was permitted in every state, I think almost without exception, that you could buy individual purchase insurance, not necessarily what you get at the workplace. That has to be priced according to the group, so you can't discriminate against people with pre-existing conditions. But in the individual purchase market, you could buy a plan that was priced according to what your health status was. The result was it was extremely affordable for most people because most people are healthy most of the time. And the beauty of that system is it encourages people to buy insurance before they get sick. What Obamacare did is it said, no, all insurance, so-called, they still use the term, but it's not really insurance anymore. It has to be available to everybody regardless of their health status. So what do people do? They wait until they're sick to pay for it. And then because of the mandates, subsidies, and price controls, they're able to get it for a price that's less than what a true market would charge them. And, if it were fire insurance, it would be like saying, you can sign up for fire insurance after your house is 3/4 burned down to the ground.
Right.
It makes no sense. It's not insurance.
Not only that, it also discourages people from actually taking ownership and responsibility and agentship of their own lives after the fact. Suppose that someone suffers from overweight, or suppose someone suffers from any kind of chronic condition. There's less of an incentive for that person to actually take matters into their own hands and lead a healthier lifestyle because they'll be covered no matter what.
That's exactly right. I mean, if it's your money at stake and you can keep your premiums down on your insurance by staying healthy, you have that incentive and you do that. And now it's like, well, somebody else is going to pay for my illness. It's a mess. By the way, on insurance companies, you mentioned that they've become middlemen. It's very true. Obamacare took them from being dominant to being super dominant. Now they are essentially a government regulated utility, and taxpayers are transferring hundreds of billions of dollars every year with a B to insurance companies and kind of hoping that some healthcare trickles down to patients. It's like $200 billion a year, and that was only for getting about 20 million with an M million Americans covered with health insurance, which is not very good insurance. In fact, it often turns out it doesn't really make the doctors or facilities available that you need or that are convenient to you. There are all kinds of tricks insurers play to try to avoid paying claims. And they can get away with that even more so now that we have the government essentially having taken them under their wing. So one of the most important things we can do in health reform is kind of break up this health insurance government industrial complex.
Absolutely. What's truly astonishing about this, and let's go back a little bit. I'm not obviously on the carrier's side, but we go back to the discussions that revolved around Obamacare at the time. That sounds to me very simplistically as if the government was incorporating or was annexing private property to be done with it as their own. Sounds unconstitutional, to say the least. I don't know about the legality of it. What was the debate like, and was the stake in the court to actually adjudicate? Because it sounds like they were taking private assets, telling those people what to do with their assets. I'm talking about the insurers, the elimination of exclusionary criteria and other regulatory impositions.
This show is brought to you by Epidermal Expressions, Fine Art Gallery and Apparel. Express your faith, love of family, and patriotism in style, from canvas to apparel. Use discount code ROAD15 for a 15% off your next purchase at epidermalexpressions.com. And now back to the show.
Well, it's a sad story. I remember it well. I was in a meeting in which the health insurance lobby in Washington, the Association of Health Insurance Plans, AHIP, the head of the group, basically said, you know what, we've decided to come to the table on national health reform, and here are our conditions. Get everybody in the country covered, but mandate that they have health insurance. In other words, make everybody buy our product.
Right.
And we'll agree to reasonable regulations of our product and our industry. Well, that was the tipping point. That's what enabled Obamacare to move forward politically. The opposition of the health insurance industry had blocked reform for many years, since Hillary Care. Well, the insurers defeated Hillary Care. Now they had changed sides. Now they were at the table. And sure enough, there was a mandate to everybody to buy their product. All these mandates and regulations imposed on insurance. The insurers now don't operate in a free market. They have so many rules they have to follow that it might as well be part of a government agency. So in that sense, yes, it was basically taking over and nationalizing a private industry, right. Something that really Congress has no constitutional authority to do, and is not a good idea besides. But here we are. And so at AFP, what we're trying to do is spend time thinking about, well, there's this Berlin Wall's been built. How can we chip holes in it big enough for patients and doctors to escape through so we can get a free market going again?
I'm kind of wondering, has that ever been taken to court, or did they just kind of wave the white flag and just fold the process?
It went to court, all right. Big Supreme Court case in 2012 was kind of one of the top headlines of the year. Basically, what the challengers of Obamacare said to the Supreme Court was, the individual mandate, that's the mandate in the Affordable Care Act that says you must have health insurance or you will pay a tax penalty to Uncle Sam. That's unconstitutional. Uncle Sam has no power to impose a mandate like that. If you allowed that, you could tell everybody you must eat broccoli. The federal government just doesn't have certain powers, and mandating insurance coverage is one of them. Well, Supreme Court was afraid to rock the boat politically. Ended up, John Roberts, the Chief Justice, they basically tried to split the baby. And what they said was, well, it's true. The federal government does not have a power to mandate that you buy health insurance, but they do have a power to tax, and they can use that tax to tax people who don't have health insurance. So it's effectively the same thing, but they call it by different words. And the result was Obamacare was upheld as constitutional. There have been other legal challenges. All have essentially failed. Congress along the way has repealed many parts of the Affordable Care Act, things you don't hear about, taxes on tanning salons and health insurance companies, something called the Cadillac tax, which basically was a tax on employer health benefits, a number of other little items, all repealed because they didn't work or they were unpopular. But the core of the law still exists, the mandates, the subsidies, and the price controls. The individual mandate, interestingly, has been mostly repealed.
Yes.
In 2017, under President Trump, Congress reduced the tax penalty for not having insurance to $0. It's still on the statute books. You're still supposed to have health insurance, but the IRS can only penalize you $0 for it. So the IRS doesn't even enforce it anymore. And ideally, we just repeal that mandate off the statute book.
And what is amazing about that repeal was that I don't recall it being advertised or on any sort of major news network announced as if it was repealed back in 2000. I think finally it was repealed in 2019, if I'm not mistaken. You're saying
January 1, 2019.
Right. So it's interesting because I never heard about it up until the point where I started investigating personally and rummaging through news. And to my surprise, I saw that it was repealed 5 years ago, which is astonishing because it wasn't really discussed. There wasn't a lot of fanfare around that, but that was a major development around the Affordable Care Act, and unconstitutional to say the least to
Right.
do this. And what's amazing is that people still receive those tax forms that are generated to indicate that you've been covered in a critical mass of the year to actually be exempt from that penalty. So the bureaucracy is still there. People are still spending the money and the resources on producing those forms and delivering them to people. Just imagine, and this is, I'm sure, I don't know if it's an oversight or because they're supposed to maintain the pretense around that this thing is supposed to keep on going. But imagine the waste just around that little inkling in the Affordable Care Act that no longer means anything, but is still costing people money and resources and time. And you get that form at the end of the year like, oh, I was covered, but I'm not supposed to be penalized anymore, for those of us who actually know about that. That is astonishing to me.
Well, and you want to put these people in charge of your health care?
Exactly.
Whole forests of trees have been cut down to produce those forms that are absolutely meaningless. Right. And it's a mess.
It most certainly is. So we know it's a mess. There's one more thing that I wanted to touch up on the Affordable Care Act, because we did talk about more Americans being certified as insured, meaning they have the title of insurance. What is there to really ascertain the quality and the any particular services or so-called healthcare benefits under those plans that cover the participants in the Affordable Care Act?
Well, a great question, and I before I answer, I want to preface it with the one thing that people do praise about Obamacare is that it reduced the number of uninsured. I mentioned earlier, about 15% of Americans were uninsured before the law passed. Today, it's about 8%. So on paper, they've cut that number in half. But just because people have a shiny plastic health insurance card does not mean they actually get health care.
That's right. Coverage
is not necessarily care. And what you find often with these Obamacare insurance plans and with Medicaid, which is, the related program for the very low income, and even just in general, because of the rising price of health coverage, they're always trying to cut back on what you can get. And in fact, these Obamacare plans are really like Medicaid with a high deductible. Deductible is what you have to pay out of pocket before your insurance kicks in. In other words, it's not good coverage. It's not good quality care. In fact, people, I think, are surprised and disappointed when they get sick. If they're healthy, they don't notice. They think, oh, it's so good, I've got that insurance card in my wallet. But when they actually get sick, that's when they discover, oh, I can't find a doctor anywhere near me who will give me an appointment because I'm covered with this subpar. I won't even call it insurance, this prepaid benefit. And so, no, Obamacare has gotten a lot of people covered on paper, but it hasn't really made healthcare more available to Americans. Only a robust, competitive market can do that.
In summary, it sounds to me like the Affordable Care Act was a wealth transfer scheme with a lot of impositions and I suppose overtake by the government of private property and assets to do with it as the bureaucrats please, under the pretense of making healthcare more affordable and more accessible, with the opposite result at the end.
That is exactly right. They said it would reduce our health insurance premiums by $2,500 a year per family on average. It has doubled health insurance premiums over the last 10 years. It's caused hospitals to close because Obamacare was funded in large part based on Medicare cuts to the Medicare program for elderly and disabled. And deductibles are up. The amount you have to pay out of pocket for your health plan, it doesn't feel like you have insurance because basically you have to fork over so much in premiums and deductibles before the insurance even kicks in. And meantime, we now have shrinking networks, so it's harder to find a doctor or a facility that your insurance actually covers. Right. And we've got the insurers getting more aggressive on things like prior authorization, making you jump over hurdles, telling your doctor, no, why don't you try some different therapy, something cheaper. The insurance companies basically practice medicine without a license, in my opinion. That's and right. All of this is driven by all these mistaken government policies. If we got rid of those, kept guardrails and safety nets, but got rid of the stupid stuff, you would see people would be wonderfully happy. And everybody would have health insurance. It would just be much more basic, affordable, portable from job to job. It would be what they want and no more, which is exactly what you expect in a free market.
And one of the things that you kept alluding to several times, which is so on point, is that physicians are left holding the bag in many cases for the bureaucratic impositions, but specifically what is deeply annoying to a lot of physicians are the prior authorizations that you've mentioned, meaning to our audience, the bureaucratic process where the insurance company denies service to the patient through the physician, and the physician through his or her office has to file paperwork to appeal that rejection or denial of service. And many of these denial of service incidents are actually arbitrary. They just do them because they can, because they trust that physicians and their offices are going to exhaust their resources or overlook maybe the denial of service, thereby getting away without providing that service, despite the patient having paid the premium for their policy and the government having forked over money, and all the while physicians are the taxpayers as well, getting paid with their own money. So that's a very interesting aspect of not only the Affordable Care Act, but just our general insurance landscape in America nowadays.
Amen. Yeah, the doctors are in some ways the biggest victims of all these changes. They're just trying to heal people, and it gets harder and harder, and you see more of them retiring early or going into solo practice to try to get away from the insurance companies. And it's really sad what's happened to medicine in this country. But I do think there's hope. I do think you can always undo the wrong things you've done.
Yes.
And that's why at Americans for Prosperity, we have what we call our personal option campaign, where we're trying to remove barriers between patients and their trusted medical professionals, trying to make it so that the government, when it subsidizes healthcare, is funding patients, not insurance companies, and basically shift power to patients, because they're the consumer of healthcare at the end of the day. They're the buyer in the market equation. They should be controlling the dollars. If we did that, wonderful things would happen. Prices would go down, quality would go up. Everybody would have more freedom to get the kind of healthcare they want when they want it, and at prices that are a lot more affordable.
Amen to that. And so, Dean, when you and I first talked, I was made aware that Americans for Prosperity has a couple of categorical pillars in which you folks are approaching healthcare. So why don't you tell us about that?
Sure, thank you. The personal option has basically 5 pillars. The first is fund patients, not insurance companies, as I mentioned. And in practice, what does that mean? That means you take the subsidies like Obamacare and you give the money to the individual patient, as a fixed amount, and say, now you get the health insurance that meets your needs. Don't be locked into whatever we're trying to dictate. And whatever you don't spend on insurance, you can save tax-free in a health savings account, which is a tax-advantaged vehicle that you use for out-of-pocket medical expenses, copays, deductibles, doctor's appointments, MRIs, you name it. This exists now, but only about 10% of Americans have a health savings account. We say, let everyone have one. That's the second pillar, HSAs for all. These are options, by the way. We wouldn't force anything down anyone's throat. And then third is remove barriers between patients and their trusted medical professionals. There are these laws like certificate of need, protectionist laws that try to, protect hospitals from competition and so on. Basically, get rid of those, and then prices come down because you get more market competition. And then the next pillar is have government safety nets, trusted government safety nets, but make them narrow, not wasteful, controlling, basically not a net that smothers you, but something that catches you if you truly fall. And so that means reforming programs like Medicare, Medicaid, and Obamacare. And then the last pillar is direct primary care, direct access to care. Let everybody who wants to just pay their doctor in cash do it, and remove the barriers. If you want to pay your doctor on a monthly subscription, if you want to pay your doctor on an ad hoc, a la carte basis, you should be able to do that. And you and your doctor decide what's the right price, the market clearing price, as I mentioned. That's the 5 pillars.
Those are terrific starting points to address a lot of the issues that we talked about. What really caught my ear when you were talking about it was the what I call the catastrophic rider insurance, that you're talking about the safety net, where someone catches a really bad break where the affordability of their medical care is going to skyrocket almost by default, like having, God forbid, a heart attack or getting into a major road accident or another physical injury or cancer, God forbid. Those things a lot of the times can cost somebody pretty much their entire net worth, if not more than that, and get them deeply into debt. And I'm wondering nowadays, are there any out there in the market, are there any insurance options that actually give you just that coverage? That's just that safety net that someone can actually purchase out in the free market.
That is a great question. I'm glad you asked it because I would have forgotten to talk about this. Yes, there are some remnants left of true health insurance out there, things that the Affordable Care Act failed to stamp out. I'll give you 2 examples. One is called short-term health plans. This is something that was created in a federal law in the 1990s. It was envisioned as bridge insurance, like between jobs or a student after graduating from college, short-term, and not regulated by all these mandates. So you could price it according to risk, and it would be very affordable, but it would be temporary. Well, the Affordable Care Act not only did not eliminate short-term insurance, they just left it as is. And then Obama in 2014 thought, oh my goodness, this is a loophole. Somebody might have some freedom here. We got to stamp that out. So they tried to go after it, and they tried to cut them back to only 3 months coverage. Your insurance policy only lasts for 3 months. When Trump came in, he changed that because at the federal level they can do this, and he made it 12 months and renewable up to 3 years. So you could have 3 years on a short-term health plan, much more affordable, like 50-80% more affordable than one of these Obamacare compliant, over-regulated plans. And about 3 million Americans are enjoying short-term health plans right now. Unfortunately, the current president is trying to go back to the Obama policy, cut it back to 3 months, 4 months in certain circumstances, basically get rid of this one remnant of true health insurance that's affordable. The second example is something called Farm Bureau health plans. I don't know if you've heard of this, but every state has a Farm Bureau Federation, which is basically a group of people who are united by their love of or connection to agriculture. Little secret, you don't have to be a farmer to join the Farm Bureau. You can join it. I can join it, and it's like, $40 a year or something. It's not expensive. And guess what? Many states, the Farm Bureau offers a health benefit plan that's basically true traditional insurance, priced according to risk, very affordable, the benefits you want, not the ones mandated by the government. So at AFP, we've been trying to get states to pass laws that say, and this is the neat part, Farm Bureau insurance is not health insurance, it's mutual aid. As a result, that exempts it not only from state insurance regulations, which can be destructive, but also from Obamacare. It's another loophole in Obamacare that states still technically get to define what is health insurance. And by doing this, you can allow, potentially millions of Americans to have affordable, portable insurance that they don't lose. It just stays with them. And so those are two examples of what we can do that's hopeful. That's, the world hasn't ended entirely.
That is actually phenomenal. You know what? I think some of the viewers here are going to realize, I think, amazing savings if they actually look into both these vehicles. And I'm sure that there are probably dozens of millions of Americans that would greatly appreciate something like this. And if they so-called choose to insure themselves or cover themselves in any way, those would be great vehicles to actually not break the bank and still be covered for emergencies, which is terrific.
Yeah, it's healthcare as it should be.
Exactly. And what's so let's go back to the health spending accounts. So as you said, as far as I understand it, at least, most Americans do not have health spending accounts. They were actually, when I looked into health spending accounts back in the day, they were restricted to, there were some restrictions as far as the provisions of the healthcare plan. They had to have a high deductible, I think, and they had to be some form of, there had to be other drawbacks to the plan to actually justify getting on a health spending account. And then there's a flexible spending account as well. What are the differences between the two, and what are the restrictions on getting one of those?
Sure. You're absolutely right about all that. There's health savings accounts and there are flexible spending accounts. The difference is an HSA you own. It's just like your IRA or 401k or your bank account. It's your financial instrument. It's specifically for healthcare. You can only use the money for federally qualified medical expenses, which happily is just about any medical expense you can think of except insurance. You can't use your HSA for insurance. An FSA, flexible spending arrangement, is something you get in the workplace. It's similar to an HSA, but it's really intended as a spending account. You can't save the money. You lose it at the end of the year. It's use it or lose it. And this is why when you go shopping in the holidays and you see signs in the stores, these items are FSA eligible. In other words, you can use this tax advantage money that you got through your employer to buy eyeglasses or contact lens solution or whatever, stock up on it, because otherwise you lose the money. It goes back to your employer at the end of the calendar year. With an HSA, you keep the money. It just rolls over from year to year. You can invest it if you want, or you can keep it like a checking account. And so you could actually grow up like a nest egg for future healthcare expenses. And they say that when a 65-year-old couple, when they retire, they're going to need $350,000 in the bank to pay for all the healthcare costs that Medicare does not cover. Medicare is skinny coverage. It doesn't pay for everything. And people will get shocked when they retire and discover that. And so an HSA is a wonderful tool that, especially if you start young and you're frugal with it and hopefully you're healthy most of the time, you can build it up into a nest egg. And now that's power you have, the government can't control easily. And so those are the two kinds of accounts, HSA, FSA. And you're right, only about 10% of Americans right now have an HSA. And it turns out it's because there are government barriers that make it almost impossible for close to 90% of Americans to have an HSA. And the main obstacle, as you mentioned, is that the folks in Congress who designed this said, well, you have to have health insurance. You can't just have the account. You also have to have health insurance, and we're going to design it. It has to be high deductible. We'll set the deductible, out-of-pocket maximums, preventive care benefits, pre-deductible, blah, blah, blah. It's very complicated. And guess what? Most consumers don't particularly want it, and insurers who sell it often find they can't price it at a competitive price. It's a health insurance policy designed by politicians. Yeah. And so it doesn't work. And yet you got to have that to have an HSA. One of the things we're trying to do at Americans for Prosperity as part of our personal option campaign is remove that requirement. Why not just let everybody have the account? Just let people save and pay for healthcare tax-free. Most people are going to get insurance anyway because they need it and they want it. You don't have to make them do it.
This show is brought to you by Epidermal Expressions Fine Art Gallery and Apparel. Express your faith, love of family, and patriotism in style from canvas to apparel. Use discount code ROAD15 for a 15% off your next purchase at epidermalexpressions.com. And now back to the show.
Preaching to the choir, obviously, it's our money, and I think we should be able to do with it as we please without anybody stirring the pot. Kenneth Arrow said that markets don't really work in healthcare. And sounds like Americans for Prosperity deeply believe in free markets actually guiding healthcare to safe shores and to affordability. So, what are there any restrictions that the government imposes on healthcare that Americans for Prosperity do support or think are reasonable?
Well, I hesitate because for every guardrail or regulation, I can think of a reason why the private sector or perhaps state and local governments could do it better. But if you put a gun to my head, I'll say, well, there's a federal law. It's called EMTALA, EMTALA. That means it says if you show up at the hospital emergency department and you've got some kind of, acute or emergency condition, they have to at least look at you. They have to screen you and they have to stabilize you. If you're bleeding, they have to stop the bleeding. Yeah. They don't have to provide your full course of treatment. They don't have to put you up overnight, but they can't just turn you away at the door before looking at you. That's the mandate from the feds. I think most Americans would say, that seems reasonable. Now, that does have a cost because emergency rooms are overcrowded. Nothing's free. But if you had, that might be a mandate that I could live with. Most of the mandates we have don't make a lot of sense. There are two in Obamacare that are very popular. One is the ban on pre-existing condition exclusions, the idea that insurance should just be, available to everybody no matter how sick. Mm-hmm. And the other is the one about keeping your kids on your insurance till they're 26, whether you want to or not. Those are popular mandates, but I don't think they make sense. They're not necessary. Maybe I'm missing something. Maybe you can tell me. Is there a good mandate?
I can't think of any good mandates that the government has imposed on healthcare, and I think you're absolutely right that every one of those mandates comes with a cost. What's amazing to me is that a lot of people overlook the fact that physicians, generally, and I'm talking about physicians out of deep knowledge of the profession and many colleagues, some of which I have deep disagreements with, some of which, not all physicians get along, as you surely know. But physicians are, for the most part, first of all, guided by the law. So there are basic laws, criminal code and civil codes that right. Any businessman, any person in society has to abide by, which I think would impose a lot of guardrails to any medical practice without the need for any additional intervention by the government. And the other thing is physicians do have a moral ethical code. I would love it if physicians would abide more by morality rather than just ethics, which are more of a man-made code. But they do have pretty strict guidelines as to how to operate in the profession and in the professional setting. And I do think that that no man gets turned away at the ER imposition or regulation or a government imposition. I think that is sort of it's preaching to the choir in a way. It's addressing something that I find it very hard to believe any physician would actually do. If somebody
Sure. Yeah.
if somebody actually shows up to a physician's office or to an emergency department in clear physical distress and in severe physical condition, I imagine that they would be seen no matter what the finances are right up front. And like you said, I mean, obviously, once things are stabilized, the finances and other issues would have to be sorted out. But I find it very hard to believe that any physician would actually turn anyone in need away right off the bat. It's something that physicians normally don't do, especially in these acute emergencies that you've described. So I think that it sounds like a very nice thing to sell to the public, that the government is actually looking out for their interests. But I don't think it's one of those issues that would really require any government intervention, considering the nature of the profession and how it is structured and from the very basic stages of training.
Yeah, I thank you for that, because I never really thought of it in those terms before. You're right. Doctors have an ethical duty and, of course, lots of legal liability. And they're not going to turn people away. Now, maybe hospital corporations that are thinking about the bottom line, they may have different incentives, but actual physicians, caregivers, they're going to do the right thing. And I'm sure they did before that EMTALA law that I mentioned came onto the books. That was in the mid-1980s. So you're right. Even that mandate is probably not necessary.
It's probably not necessary. And I think, by the way, just judging by what the accessibility or the widespread of social media, I imagine anybody turning someone like that away from their emergency department would suffer catastrophic reputational damage as a hospital. And
Right.
if there's an individual physician involved, I'm sure that would not look good on their resume. So beyond just the moral obligation of a physician to see anybody like that, and naturally the laws, I think it would be almost impossible for me to imagine something like that. I imagine there's exceptions, but something widespread that needs to be addressed by a law, that sounds very implausible to me. It's interesting because I think a lot of the issues that I hear, and this is, by the way, very common amongst physicians as well, they have people generally in our country nowadays, and it's not the same country as it was 20 years ago, have a deep distrust of the free market and the free market's ability to sort out what you and I talked about at the beginning of our conversation. And I think that is where the leap of faith that needs to happen for things to start moving in the right direction must happen. Because when you really look at the person-to-person relationship that a physician has with their patient, whether they've known them for a minute or they've known them for a long time, there's a lot of very reasonable nuance in that interaction that can make things, first of all, just more jelly and flowy, in the sense that the fluence of any interaction would be much easier without government impositions, much more affordable without government impositions. Just think about the paperwork that we talked about earlier. And I think the ability of people to negotiate prices versus value provided would be so much easier and so much more fluid to make things much more affordable to anybody really seeking healthcare, I think, within reason. It's mind-boggling to me that we've gotten this far, and I'm actually very hopeful to hear about your approaches to address these issues that are fundamental issues to our healthcare.
Well, yeah, very well said. I mean, you're right. You and I just know, you from your actual hands-on experience with patients, me as a policy wonk in my ivory tower, we know that markets work in healthcare, but people are afraid of them. It's like that line in Star Wars, how will the emperor maintain control without the bureaucracy? It's like, if they don't see the government doing it, they don't think it'll happen. But we know that, in fact, people are actually pretty good. If they can meet in voluntary and mutual exchange, everybody tends to be better off. And So our strategy at AFP is, okay, let's not do a frontal assault. Let's not try to eliminate every government health care program, every mandate, and so on, much as I would love to do that. Let's just poke holes of freedom and let people vote with their feet. And what will happen is the market will start to outshine the government scheme, and people will begin to realize, we're fine, we're safe. Hey, this works so much better. I don't need that. Thank you for that program. I don't need it. It's good. I'm good. And that's a slow, gradual process, but we know it works. Like in education, we have a whole movement now to just let the parents control where the money goes and where their child goes. And, the sky has not fallen. And in fact, people are happier with what's going on in education. Well, the same can happen in healthcare. And, if we could go fix everything overnight, that'd be great. It would be very disruptive. It's probably better to be gradual, but we have to make movement in the right direction. Otherwise, we're just going to, through inertia, end up in the single payer monopoly that you and I both know is a bad idea.
Yes, it is. And Dean Clancy, I wanted to thank you so much for coming on board and discussing amazing and unknown aspects of the Affordable Care Act to many. And it was a pleasure having you. I look forward to speaking with you in the future again about other issues related to healthcare. And God bless you.
Oh, Doctor, it was a pleasure on this end as well. I was honored and really enjoyed it.
Thank you, sir. Take care.